Hello, team. Happy Wednesday afternoon. I hope you're all doing well. I have survived day number 2 of homeschooling/working. It's thrilling. A few things that I wanted to make sure that I got to at least let you guys see my face about, or so you could hear me talk through it a little bit. A couple things that I want to make sure we are all doing consistently. I know I talked last week about making sure that we are managing those transfer calls. I do want you to know I have been asked to create an emergency plan should we not be able to manage transfer calls of the emergent type that come in. I'm working on that. I don't know what that looks like yet, so there will be more to come on that, but people are aware that we need some support. I just also don't know what that future looks like either. So when I know more, you will know more. Besides that, another thing that I want to make sure we are consistently doing is that we need to make sure not only that we are asking and reiterating multiple times throughout the phone calls of transfer calls about the facility we're sending to, we also need to make sure we're wrapping up every single call. You need to make sure that at the very end of your call, you are restating where the patient is going, facility, as well as level of care, accepting physician, and then bed number when we have it. So if you don't have the bed number, no matter what, before any of the providers get off the phone, we need to make sure that we reiterate, Dr. McGillen, you're accepting this patient to the floor level of care. We will be bringing the patient as soon as a bed is available. The patient will be placed on a wait list at the Hershey Medical Center for a Hershey Medical Center floor bed. If there are other things that happen in that call, such as I understand you've accepted this patient to the Hershey Medical Center as an IMC patient, but we would like to be placed in the ICU bed, blah, blah, blah. That will always give our attendings the opportunity to redirect us if we have not heard everything that needed to be heard during that call. There are times when they cut out. There are times when we get distracted because there are a lot of things going on. And so that loop and follow-up ensures we are all on the same page. I'm going to give a huge shout out to Joy here because she almost 100% of the time is doing that already in her practice. It's a great practice to have, so we need to make sure we're always doing it. So please start integrating that into your process right now. Starting next week, I will be I've asked anytime the calls are reviewed, whether Darcy or Amanda hears them and we're not hearing wrap-ups, I want to know so that I can follow up with each of you accordingly. It's going to take some time to get into the habit of it, but it is critical. With the expansion of our health system and things going on, we need to make sure we are on the dot. Yeah, definitely. The other thing that I want to make sure that we're doing throughout the day is following up consistently, regularly about with our referring facilities. And when we do that, we need to not only call the facility and let them know we still don't have a bed. I really want us to start doing, like, as soon as possible, calling our attendings and saying, I want to let you know this patient still does not have a bed in the organization. Would you like to consider bringing it to our emergency room at this time? We need to get more proactive with what we're doing with our transfers. I know that's hard because our organization is typically quite full. So I want us to start really manhandling those better. I know the pendulum keeps swinging back and forth, and we're all kind of getting whiplash about where do we land with what we bring in. I will tell you there is a lot of push to get our referral patients in, and so we really do have to start weaving them into how we do patient placement as well as bringing them into the emergency room whenever we have the chance. My gosh, you poor people, I'm so sorry you have to look at me. That being said, if we have like under 10 boarders, even under 15 boarders in our emergency room, we really should bring in our transfer patients as much as possible. I know that feels uncomfortable and that we're leaving patients in our organization in places they shouldn't be, but those patients are still receiving our care, and that's how we used to function in our organization with transfers. We need to start getting back to that. It's not as aggressive as we used to be, probably. We used to always bring everybody in. We can't be that aggressive because our capacity has gone up so much, and we know our emergency room is quite busy. So we have to be cognizant of that, but we really need to make sure we're considering those transfers as much as possible. We'll keep working through that. I have worked with Holy Spirit this week about streamlining some of our processes. I have worked with Dr. Armin and Dr. Mackay about streamlining a little bit of our surgical case transfer cases as well. So hopefully I'll have some better processes in place for us coming up that will allow us to spend less time managing some of these calls and just getting right down to the nitty gritty and moving forward. So I know it's a lot. I know it's not real clear. I know it feels like everybody's got their hands in our business right now. They do. But you know, it's okay because we still do our business and it's going to be fine. The good news is people are interested. They're learning from us. We just have to always remember to be positive and professional and try not to get too frustrated with all the questions. I am working on getting that to secede, reside. It's not reside. It's not secede. Subside. Ha! There it is. Yeah. I'm trying to get the nursing leaders to really start to trust what we're doing. They've been more involved. They understand some of the barriers they didn't understand before. So I'm hoping we're going to make that transition. It's probably not going to be an easy one. But stick with me. I'm trying my hardest. The last thing that I put in the updates information is that please make sure that your phone is logged out when you leave. Apparently, we're having some trouble with that, and people are being logged back in when you hang it up or take it off. So just double check your phone once you put everything away. Just go make sure you're logged out. All right, that's it. Somebody's calling me. Most people are trying to call me. I don't know. I'll talk to you guys later. Have a good one. Message me if you have any questions about anything. Okay? Thanks. Bye.